people with sickle cell disease have a different type of hemoglobin, which is not the normal type. Okay, so normal hemoglobin is called hemoglobin A, and people with sickle cell disease tend to have hemoglobin S. And this hemoglobin S behaves differently under certain conditions. So ordinarily, our red blood cells are supposed to be round or donut shaped, like the round donut with a depression in the center. People with sickle cell disease would have a round cell, but under stressful condition, these cells now change shape, begin to look like banana. So they sort of distort, and with this distortion, they don't perform their function as they should. They are not very flexible. They cannot maneuver through the blood vessels, the tiny blood vessels, as they should. So sometimes they clog at the junction between a blood vessel where the blood vessel branches. Okay, and this leads to blockade of blood flow to certain parts of the body, and this is what leads to pain. So people with sickle cell disease, one of the commonest symptoms they may have is pain, recurrent pain. So when there's reduced blood flow to a certain part of the body, either the leg or the arm or wherever, it results in pain or tissue damage. Cell disease is acquired through it's an inherited condition, So people who have the disease means that they acquired it from their parents. Their parents pass on abnormal genes to them, so results in the disease. So it's not a disease that comes by chance or by maybe exposure to environmental factors. It is purely inheritance. So there are no other risk factors for sickle cell disease besides having two parents who have at least a copy of the abnormal hemoglobin gene, for which they pass on to you. So there's no other way by which you can acquire sickle cell disease except by this mechanism. Okay, most cases of sickle cell disease are found in sub-Saharan Africa, 70% of the world numbers. So it's about 7.7 million worldwide. And out of this number, 70% is found in sub-Saharan Africa, of which Ghana is situated. When we come down to Ghana, the data that we have suggests that 2% of all newborns have sickle cell disease. So, and this is data from the newborn screening exercise. So, when you have 100 children born, at least you have 2 of them having the disease. Okay, and if I extrapolate this into the numbers, we're talking about between 12,000 to 15,000 deaths every year in Ghana. And I want to believe that even this is an underestimation, because there are those who don't give birth to their children in hospitals. So those ones don't get captured. So this is just an average estimate of the numbers we're talking about. Both parents will have to contribute an abnormal gene for the child to have sickle cell disease. So the sure way to prevent it is to know your genotype. So would be couples who are embarking on conception of a pregnancy journey, if they know their genotype and they are aware that potentially they can have a child with sickle cell disease and decide not to embark on it, then that will not result in a child with sickle cell disease.